Kali is asking the question how she's 40, which I don't believe for a minute. When she smiles, she looks more like 30s, but then she can't stay smiling all the time. And what happens with patients' faces is when they smile, give us a smile, the cheek mound rises, the muscles of the cheek rise up and fill up the void that has been left with aging. And when she doesn't smile, what you see is that she is looking a bit drawn out, more on the right side compared to the left side, because she has lost volume in this area. Now, there are two kinds of volume loss that happen in this area. One is a volume loss of a fat pad that is right underneath the eyelid muscle, and then the second fat pad is deep inside the cheek, right on top of the bone. So these two fat pads contribute to a smooth transition of the lower eyelid to the cheek. So when you see, so this is a great example. So you see how long my lower eyelid looks? It looks long not because the skin has lengthened, but because when I was younger, I had volume right up till there, so that the eyelid was only this long, right? And the same process happens with everyone. So there is a ligament called a teardrop ligament, and then it joins up with the orbitomalar ligament, and that is the point at which the skin can't move, where the fat goes and you get this big dip or a divot. And when we do a non-surgical technique, we essentially try to blend the transition between lower eyelid. If we wanted to do that, we can mimic the action of filler injection. Let's do it on this side. So if I push the cheek mound ever so slightly, you can start seeing that she looks less drawn out, and the eyelid now looks much smaller than when I let go. So if I were to push the cheek mound up, you see that she looks like she has got a shorter lower eyelid compared to when I drop it, and then you think, oh, okay, the eyelid is that long. So in this area, the dermal filler application is a good application. I can also do a fat transfer, but clearly there is more downtime to fat transfer. And you might ask, why don't I just do a lower eyelid lift? And the reason why a lower eyelid lift is a little riskier in a patient who's got an eye that stands proud of a cheek, right? So we call it the negative vector eye, is because you are already dealing with an eyeball which is projecting forward, and if you tighten this, it can sometimes cause an eversion of the lower eyelid. So if you insisted and we had to do the surgery, we would always combine the lower eyelid lift with a fat transfer.